Barriers. Obstacles that restrict people worldwide from reaching their full potential. Throughout history, many have fought against various barriers, but despite their efforts, many barriers still stand today. However, their efforts were not in vain. This ideology is epitomized by the African American racial barrier. Blacks before our time had many dreams, one of which was a tomorrow without racism. But has their dream been fulfilled? Till this day, blacks are chained by the shackles of racism, more specifically, medical racism, a manifestation of systemic racism in healthcare. This includes barriers in obtaining quality healthcare, medical education, and opportunities. In fact, 72% of African Americans still perceive discrimination in healthcare, but medical racism has consistently been overlooked by many, except for one man. One who vowed to fulfill the African American dream despite racial opposition. One black surgeon named Daniel Hale Williams. Stitching Hearts, Stitching Dreams by Divya Brahmbhatt and Dhruv Patel. During the late 1800s, racist ideals such as the separate but equal doctrine dictated life for African Americans both in Chicago and nationwide, ultimately forcing blacks to lead a much harder lifestyle than that of whites. Inevitably, the medical field also felt this racial barrier. For years, whites made major advancements in medicine, while blacks were left behind both in terms of quality healthcare and medical education. Living in polluted, disease-prone areas where hospitals refused to treat them, African Americans had an average life expectancy of only 33 years, while that of the white population was nearly 47 years. These racial disparities were also prominent in healthcare education, as only a few blacks like Daniel Hale Williams were properly trained. Noticing these barriers, the Freedmen's Bureau was established in 1865 by the government to provide blacks with the medical care that they had so long been deprived of. By establishing clinics and medical schools, Freedmen's treated and trained thousands of African Americans. However, these benefits were short-lived as racist protests forced Freedmen's to close its doors, leaving blacks hopeless once again.
With typhoid, cholera, smallpox, and other diseases prevalent, and the death rate always too high in Chicago, there was a need for a permanent health facility.
Williams' lifetime was clouded with this racial and medical bias, but he instigated an ongoing movement to chip at these barriers. By creating Providence Hospital, the first interracial hospital in the U.S., Williams served the African Americans' need for healthcare education and medical care. By also performing the first open-heart surgery in the U.S., Williams set surgical standards globally. He ultimately created the National Medical Association to support the overarching civil rights movement and establish an organization that advocates for the black community's medical needs even today. Williams first set the goal of creating an interracial training hospital. During that era, forming an integrated hospital was not only viewed as impossible, but also meaningless. However, his charisma, passion for service, and strong community awareness and outreach programs for black and white Chicagoans helped his idea gain both traction and funding. And on May 5, 1891, the Providence Hospital and Training School was established. Providence's unprecedented class structures and mock operations established it as an institution of opportunities, and quickly validated its importance.
So it was the training ground for black doctors who couldn't have gotten trained anywhere else. And then those doctors, once they were trained at Providence, then they went throughout the country and then they could be leaders in the community. So it was a breeding ground for some of the best doctors and best leaders in the black community.
Providence was also known for its quality medical care, as out of its 457 surgical operations in 1893, more than 90% of them were a success, much higher than the national average of 52%. On July 9, 1893, Williams met James Cornish, on whom he performed the first ever successful heart surgery, a task most doctors of the time feared. This feat was publicized nationwide, causing President Grover Cleveland to appoint Williams as the chief surgeon of Freedmen's Hospital, a government-managed hospital that had an extremely high death rate.
It was neglected prior to him coming there. He came in, he improved the facilities, he got an ambulance service, he trained the doctors, improved their learning, so that they could be better doctors and provide better service.
Many regarded Dr. Williams at the hospital to be an asset to America, including D.D. Moore, a respected politician. He characterized Dr. Williams' management of the hospital as clean-cut, thorough, capable, and progressive. He has instituted improvements greatly needed there, making the hospital fully abreast of the best-equipped hospitals of the day. Prior to the 1896 elections, Williams had the authority to make purchases for freedmen without any strict policies. But the new administration of 1896 changed the policies freedmen had to follow, and financial misuse allegations were made against Williams. Government reports also backed these charges and found that Williams had supposedly made corrupt purchases and abused his power. Despite Williams showing past and accurate financial records that disproved these allegations, societal opposition heightened. Characterized as a felonious thief and his past accomplishments disregarded, Williams was pressured into leaving freedmen's as an unsung hero. Freedmen's interracial conflicts were reflected in neighboring white and black communities, where heightened racist beliefs were causing blacks to lose access to medical education and care once again. Determined to prevent a relapse of severe racial barriers, Williams co-founded the oldest and largest African American medical organization in 1895, the National Medical Association, or NMA. Conceived in no spirit of racial exclusiveness, fostering no ethnic antagonisms, but born out of the exigency of the American environment, the NMA supported blacks medically. Until then, the white-only American Medical Association had neglected blacks' medical needs, and therefore, Williams worked with the National Medical Association to publish many articles urging for black hospitals. Although the American Medical Association did implement restrictions, the NMA successfully established hospitals including the Lincoln Hospital and the Flint Goodrich Hospital through what was deemed the Black Hospital Movement. These new opportunities drove thousands of blacks into Chicago, resulting in increased racist protests from powerful white-only groups like the American Medical Association who disapproved of the increasing black opportunities. Consequently, Providence financial resources were cut, and it plunged into a financial crisis. Seeing this was harming Providence service quality, the National Medical Association began fundraising with baseball games, charity balls, and community outreach efforts. These efforts were highlighted as being one of the greatest steps for African Americans since the Emancipation Proclamation. Although Providence did eventually recover financially, the dip in quality it had seen continued to affect thousands of Chicagoans for years. While Providence recovered, Williams unfortunately passed away in 1931, causing the NMA to continue his legacy during World War II, when they shared Williams' healthcare protocols with Allied nations and saw a significant reduction in heart-related deaths. Afterwards, the NMA also threw themselves into the civil rights movement, organizing the acclaimed Imhotep National Conference on Medical Integration in 1957 and empowering thousands to voice for hospital integration. They also maximized their use of marches and journalism to enact federal change and propose universal medical insurance. However, the American Medical Association opposed these ideas and linked them to socialism. Even with the 1964 and 1965 legislation for senior citizens' medical insurance and hospital integration, acts like the Health Security Act of 1993 were still unratified. Controversial letters and petitions were exchanged between the National Medical Association, American Medical Association, and Congress for years until 2008, when the AMA apologized to the NMA for their racist actions of the past, thus ending the feud between them. In 2010, Congress also passed the Patient Protection and Affordable Care Act, or Obamacare, to provide medical insurance to over half the nation, making the NMA's voices heard.
The NMA recognizes Obamacare as being the law. We also understand that at least 20 to 30 million people would suffer if Obamacare went down. We are sworn to protect the principles of healthcare reform under the law, and the best way that we can do that is to uphold the principles of the Affordable Care Act.
Blacks before our time have led various initiatives to tackle severe medical disparities, but statistics show that the medical racism barrier stands even today.
There's a shortage of black practitioners. Blacks make up more than 13% of the U.S. population, but just 4% of the nation's doctors.
While we now see a degree of equality in the medical field, we have yet to see equitable outcomes. However, this doesn't mean the efforts of Daniel Hill Williams were in vain. Although he may not have broken the barrier completely, he undoubtedly chipped at it and showed the nation that while barriers cannot be broken by one man nor one action alone, a difference can still be made. By inciting America's first interracial hospital, first open heart surgery, and first ever organization for African American doctors, Dr. Williams evidently broke social norms as an African American leader who has and will continue to inspire generations to come.